Hi, we're going to be talking briefly right now about substance abuse and seniors. Now, abusing drugs or alcohol is dangerous for an individual at any age, but the elderly population is at greater risk for certain complications and adverse events due to physiological changes that occur with aging. According to the American Society of Addiction Medicine, ASAM, the elderly, cachectic, or debilitated patients are more likely to experience respiratory depression and constipation. According to drugfree.org, between 1997 and 2008, the rate of hospital admissions for conditions related to prescription medications and illicit drug use rose by 96% among people between the ages of 65 and 84. For people 85 and older, admissions grew 87%. Elderly patients who misuse or abuse their prescribed medications are increasing their risk of dangerous side effects, such as drug-induced delirium or dementia. SAM-HSA points out, yet the non-medical use of prescription medications continues to rise in the older adult population. What we're going to talk about briefly here is the signs and symptoms of substance abuse. They can be easily confused with symptoms of comorbid conditions. Family members, for instance, may assume symptoms such as memory loss or resulting from progression of Alzheimer's disease, when in actuality they're being caused by misuse of medications or adverse drug interactions. Potential risks of drug or alcohol abuse and or addiction for seniors creates an increased sensitivity or decreased tolerance. Less substance produces a stronger effect. Higher blood concentrations due to slow metabolism. There's a risk of accidents, falls, injuries, excessive daytime drowsiness, disorientation or delirium, significant memory problems, slowed respiration, worsening liver disease, cardiovascular disease, or diabetes, sleep disruptions or disorders, ulcers and gastrointestinal problems, adverse drug interactions resulting in seizure, coma, or death. When prescribing opioids to elderly patients, physicians often start at 1/3 to 1/2 the typical dose. Elderly patients should also be more closely monitored through the course of treatment. But physicians alone cannot monitor patients continuously. So caregivers and family members must also pay close attention and watch for potential signs of abuse or dangerous side effects. We have some resources that we'll be forwarding to you, and you can check out the website that's related to this material down at the bottom shortly. I want to thank you. Be happy, be healthy. Bye.
The American Red Cross urgently needs blood and platelet donations and asks donors to schedule an appointment to give now. Every 2 seconds, someone in the United States needs blood. Your blood donation is critical and can help save lives. Please, schedule an appointment today. Download the Blood Donor app, visit redcrossblood.org, or call 1-800-RED-CROSS today. You can make a difference.
Hi, this is Alfred Brock, and I'm coming to you from Data Central. We're going to be hearing some information today about substance abuse from the Substance Abuse and Mental Health Services Administration, SAM-HSA. Talking about prescription drug misuse and abuse. SAM-HSA addresses prescription drug misuse and abuse using a public health approach that includes early intervention, prevention, treatment, and recovery support services. Prescription drug misuse and abuse is the intentional or unintentional use of medication without a prescription, in a way other than is prescribed or for the experience or feeling it causes. Results from the 2014 National Survey on Drug Use and Health indicate that about 15 million people between age 12 or older used prescription drugs non-medically in that past year, and 6.5 million did so in the past month. This issue is a growing national problem in the United States. Prescription drugs are misused and abused more often than any other drug except marijuana and alcohol. This growth is fueled by misperceptions about prescription drug safety and increasing availability. A 2011 analysis by the Centers for Disease Control and Prevention found that opioid analgesic, that is pain relievers, sales increased nearly four times between 1999 and 2010. This was paralleled by an almost four-fold increase in opioid, that is narcotic pain medication, overdose deaths, and substance abuse treatment admissions, almost 6 times the rate during the same period. Prescription drug abuse-related emergency department visits and treatment admissions have risen significantly in recent years. Other negative outcomes that may result from prescription drug misuse and abuse include overdose and death, falls and fractures in older adults, and for some, initiating injection drug use with resulting risk for infections such as hepatitis C and HIV. According to results from the 2014 NSDUH report, 12.7% of new illicit drug users began with prescription painkillers. A 2008 report by the Coalition Against Insurance Fraud estimates that the abuse of opioid analgesics results in more than $72 billion in medical costs alone each year. This is comparable to costs related to other chronic diseases such as asthma and HIV. The problem of prescription drug abuse and overdose is complex, involving insufficient oversight to curb inappropriate prescribing, insurance and pharmacy benefit policies, and a belief by many people that prescription drugs are not dangerous. The 2014 National Drug Control Strategy serves as the blueprint for reducing drug use and its consequences in the United States. The new strategy reviews the progress made over the past 4 years and looks ahead to continuing efforts to reform, rebalance, and renew the national drug control policy to address the public health and safety challenges of the 21st century. Thank you, and there'll be a link down at the bottom here that you can check it out amongst the other ones. Be happy, be healthy. Talk to you soon.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Another quick shot here from Data Central concerning information from the Substance Abuse and Mental Health Services Administration. We're going to be talking about types of commonly misused or abused drugs. Now, you can learn about the 3 most commonly misused or abused types of legal drugs. That's opioid analgesics, that's pain relievers, psychiatric, and over-the-counter. So first of all, opioid pain relievers. Opioid pain relievers reduce the pain associated with many conditions, including cancer, arthritis, and other degenerative conditions. They are also used to alleviate short-term pain related to injuries, surgery, or dental work. For some people, they don't work. They just mask the pain. The pain is still there. And for some folks, they're allergic to them. Now, there are different kinds of pain medications, including non-steroidal, anti-inflammatory drugs, and opioid analgesics, each type with various advantages and risks. Pain treatment, whether it's acute or chronic, should be individualized for the patient and assessed at frequent intervals. And non-medication therapies should also be considered. The use of opioid pain relievers exposes users to risks of overdose, dependence, and addiction. Careful consideration should be taken when determining whether an opioid pain reliever is appropriate. Those who abuse them sometimes alter the route of administration. That is, they don't take the pill, they snort it or inject it to intensify the effect. The use of opioids alone or with alcohol or other prescription or illicit drugs can cause sleepiness, confusion, and slow or stopped breathing, leading to overdose and even death. Opioid misuse and abuse continues to be a major public health problem in the United States. From 1999 to 2013, the rate of death from opioid pain reliever overdose nearly quadrupled. Deaths from heroin have also increased sharply since 2010, with a 39% increase between 2012 and 2013. Examples of opioid pain relievers include drugs that contain the active ingredient codeine, hydrocodone, oxycodone, just to name a few. As for psychiatric drugs are prescribed by healthcare practitioners to treat mental illnesses such as depression, schizophrenia, bipolar disorder, attention deficit hyperactivity disorder, and anxiety disorders. Commonly prescribed medications have been abused include sedative medications and a class of drug called benzodiazepines, such as alprazolam, also known as Xanax, clonazepam, also known as Clonopin, and diazepam, Valium, and the antipsychotic medication quetiapine, which is known as Seroquel. These medications alone or in combination with other drugs can produce sedation and euphoria, a high. Hypnotic medications that help with insomnia can also be abused, and examples of such a medication is zolpidem, known as Ambien. And another class of medications used to treat attention deficit disorders includes stimulants. Stimulants may temporarily increase alertness and energy and have a calming and focusing effect on individuals with attention deficit hyperactivity disorder. Stimulants include amphetamines such as Adderall and methylphenidate, Ritalin, and Concerta. In 2010, according to the National Institute on Drug Abuse, about 1.1 million people abused stimulants, which are used to treat attention deficit hyperactivity disorder and narcolepsy. Side effects of stimulant overuse can include psychosis, seizures, and cardiovascular complications. Finally, over-the-counter drugs. OTC drugs do not require a prescription. However, many over-the-counter drugs contain ingredients that can be abused. And you'll be able to learn more about that by checking out the link down below. It's a quick one right here. Be happy, be healthy, talk to you again soon.
The thought of my sons growing up without me inspired me to quit smoking.
I talked to my doctors, and then I threw away all my cigarettes, ashtrays, and lighters.
I started exercising instead of smoking.
Letting my friends online know I was quitting kept me on track.
Staying away from alcohol when I was first quitting was key.
I kept on trying, learned something each time.
Do whatever it takes.
No matter how many times it takes.
We did it. You can too.
For free help, visit cdc.gov/tips.
How you doing? Here's some information we have from the state. Borg Warner has tweeted a special thank you to the Hungarian ambassador, to the U.S. Dr. Laszlo Szabo, and his team for visiting the Technical Center in Auburn Hills, Michigan. Last week, they were honored to share a company update and growth in Orlani and enjoyed a discussion on the European auto industry. So good for you, Borg Warner, and thank you, Hungarian ambassador Dr. Laszlo Szabo, for popping in. And we have something coming in from David Egbert. And Brian Calley states that Michigan's top rankings in manufacturing job growth, per capita income growth, give a sense of how far we've come in the last 7+ years. So we're moving on up. Got to work together and be kind to each other, right? So right now, also in from Michigan, we're learning that Michigan is ranked #1 for the Great Lakes states in private sector job growth and 6th in the nation. So that's great. We're doing good and everything's looking up, right? So if you got an opportunity here in Michigan, reach out and take it. Enjoy yourself. And we have lots of support materials for you to assist you with your business opportunities, your business growth, and your sustained enjoyment of the economy. Talk to you soon. Okay, we're going to be back in just a moment after this PSA.
You have the power to make this decision to quit smoking. It took me to get to a mature age where I understood that if I didn't stop, I was gonna put myself in the same position that my mother was in. And I wanted to make a choice while I still had the chance to be here for my daughter.
You can quit. For free help, visit cdc.gov/tips.
That's cool. here's our national news, and we're going to be talking about something that it's in the background there, but it affects a lot of people. That's the official harmonized tariff schedule this year for 2018. Now, the basic edition of the 2018 harmonized tariff schedule took effect on January 1st, 2018. And what I'm going to read to you is the most recent online version of the schedule. The USITC, the Office of Tariffs Affairs and Trade Agreements, is responsible for publishing the harmonized tariff schedule, and the HTSA provides the applicable tariff rates and statistical categories for all merchandise imported into the United States. It is based on the International Harmonized System, the global system of nomenclature that is used to describe most world trade in goods. Although the USITC publishes and maintains the HTSA in its various forms, Customs and Border Protection is the only agency that can provide legally binding advice or rulings on classification of imports. So that would be the Customs and Border Protection. You'd want to talk to them if you're importing anything. You want to talk to them too when you're exporting. Contact your nearest customs office with questions about how potential imports should be classified, and exports too. For a binding ruling on classification, contact the Bureau of Customs and Border Protection. The harmonized tariff schedule is available from the Government Publishing Office in hard copy form if you want a copy. And if you'd like to order it, you can get it at the link that's going to be down at below. You can get the 2018 HTS can be ordered from http://bookstore.gpo.gov. That's http://bookstore.gpo.gov. So we're moving into the 21st century pretty deeply here. It's been 18 years, right? So importing and exporting, learning all about it. So there's been some changes to the official harmonized tariff schedule this year that has potentially affected trade. Right now it's not affecting us, and hopefully it won't. I want to wish you all a happy and healthy rest of the week there, and have a great day and enjoy Wayne. Go Michigan.